Hello, Assalamualaikum. I'm Mrs. Noreen. I'm Dr. Sindhu, one of treating doctor here today. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. And tell me more. I'm very sorry to hear about that, Mrs. Noreen, and I understand that being parent, how difficult situation would be for you. Is there anything else you want to tell? Mm-hmm. All right, Mrs. Noreen. In order to better understand, I need to ask a few questions regarding a 3 months baby. Is that okay with you? Thanks for your cooperation, Mrs. Noreen. What do you do when he cries? Mm-hmm. Okay. Do you think that he responds to comfort bears? Mm-hmm. Have you noticed that his condition worsen with comforting meals like playing sounds or lights? Mhm. All right, Mrs. Noreen. Can you tell me, does he start crying all of a sudden? Mm-hmm. Okay. And what is his posture like when he cries? Mm-hmm. He draws up his legs, bends his knees, and seems to scream at the top of his voice. Mm-hmm. Okay. So, have you ever touched his tummy when he cries? Okay. Does he have any fever along with that? Have you noticed any rash on his body? Mm-hmm. Okay. Any neck stiffness? Any pulsating? Mm-hmm. How about his bowel movements, bowel habits, Mrs. Noreen? Okay. Is he passing stools normally? Mm-hmm. Okay. Have you noticed that he pass a reddish jelly-like stools? Okay. And does he seem to have a blocked nose? Any difficulty in breathing? Any cough? Mm-hmm. Does he pull his ear? Okay. Have you noticed any discharge from any of ear? If you have noticed any swelling or lump in his genitalia? Okay. If there is any history of trauma, Mrs. Noreen, if he had fall from bed, okay. And how is he being fed? Mm-hmm. Okay. Has there been any difficulty in trying to get him to feed? Okay. Does he get tired or any pallor while taking the feed? Okay. Have you noticed if any specific food that you take yourself makes him cry? Mm-hmm. Okay. Do you burp him after feeding? Okay, Mrs. Noreen, have you started feeding him solids? Okay. And is he passing urine normally? Mm-hmm. Have you noticed any jerky movements in his body? Mm-hmm. Do you check his diaper when he starts crying? Mm-hmm. All right, Mrs. Noreen, has he received the vaccinations recently? Okay. And if you are giving him any medicine, what was his birth, Mrs. Noreen? It was normal, okay. And what was his weight at the time of birth? Okay. If he cried immediately, okay. Any complication after birth? Mm-hmm. Um, and is he allergic to anything? Mm-hmm. All right, Mrs. Noreen. And did you get his labs done recently? Okay. All right, Mrs. Noreen. Is it okay if I ask a few personal questions to better understand his condition? Thanks for trusting me, Mrs. Noreen. So, what does the child's father do for a living? Okay, and what about you? Is he your first-born child? How about your mood, Mrs. Noreen? Mm-hmm. What kind of weather do you like the most? Mm-hmm. Okay, and what are your most worries? I understand your worries, Mrs. Noreen, and you not to be worried. I'm here to um, um, tell you everything, okay? And I'll try best of my abilities to solve this problem. If it makes sense to you, Mrs. Noreen. Mm-hmm. All right, Mrs. Noreen. So, your son Ali has been crying excessively in the night for the past 3 weeks now. Is there anything else you want to add? Mm-hmm. All right, Mrs. Noreen. So, the history you have shared in question I've asked, I came to conclusion that most probably seems to have infantile colic, okay, which simply means cramps in the tummy. Is that okay with you? Yes, Mrs. Noreen, it does appear quite scary and troublesome, but in fact, it is quite harmless. And in it, the infant has episodes of crying where all efforts at comforting are ineffective. Um, and this crying is for more than 3 hours per day, okay, and for a minimum of 3 days per week and lasts for longer than 3 weeks, okay, and it improves on its own by the time the child is 4 or 6 months of age. If it makes sense to you, Mrs. Noreen. Okay, Mrs. Noreen, and along with it, I'll suggest you to please continue to feed him and burp him after every feed. Okay, burping is the most important thing for your baby. Okay, and do you know the correct technique of burping? All right, Miss Noreen, I'm here to tell you. Okay, put him on your shoulder. Okay, and slowly tap his back with your hand till the burp thrice. Okay, and if he throws up a little milk, that's normal and nothing to worry about that. If it makes sense to you. Yes, Mrs. Noreen, you can also uh, many few things to help soothe your baby. Okay. Mm-hmm. Yes, and you may take your son for a car ride or a walk in a stroller, something that vibrates or has small jerks, okay? And you may try giving him a warm bath, and wrapping in a blanket sometimes helps as well, okay? And you may rub your infant's tummy or place him on the tummy for a back rub, if it makes sense to you, Mrs. Noreen. Mm-hmm. Yes, Mrs. Noreen, you can play an audio of heartbeats or soothing sounds, okay? And along with that, I'll suggest you to provide, white noise like vacuum cleaner, clothes dryer, dishwasher, commercial white noise generators. These may also help. Okay. Mm-hmm. And while you care for your infant, it is important for you to take care of yourself as well. Okay, and you may take a turns with your husbands to attend to the baby. And it is okay to put the baby in the cot for some time while he cries. So you may get a break if it makes sense to you, Mrs. Noreen. Mm-hmm. All right, Mrs. Noreen, don't hesitate to ask friends and relatives for help when you feel overwhelmed or exhausted. Okay, and try to sleep when your baby is sleeping so you are well rested before the crying episodes. Okay, is there anything else? Yes, Mrs. Noreen, I will have like to see your child, so I'm examine him and confirm the diagnosis. Okay, when can you bring him? Is it convenient for you? All right, Mrs. Noreen, is there anything else that you would like to ask me today? All right, Mrs. Noreen, here is a leaflet. It includes all the information regarding his condition. I hope it will be helpful for you. Take good care of yourself and your child, and I wish him a healthy life. Take care. Bye bye.